to really open up our economy to focus on the challenge of the livelihood of our people. We've been saving lives. We're quite happy that at least we've managed to contain this problem and contain the spread. We're relatively okay, we're relatively fine as a province, but we know as long as there's still one person who's still active with COVID-19, we are not safe. We are all susceptible, including those who are vaccinated. So the campaign like this helps us to continue putting more emphasis and also putting more impetus on the program that we have started on vaccination. We want to see Ebubeleni Festival. We want to see Buyelekaya Festival taking place. We want to see fans back to our stadiums so that people enjoy themselves. Remember, when we look at the issues of psychosocial support, you need people relaxing, enjoying themselves. We know what this COVID has done to our people. So we definitely want our people to chill, to relax a bit. So the campaign like this helps us to really continue forging ahead and marching on to address the challenge that we have.
We also understand that, the theme being it, and also as I am a member of the National Coronavirus Council, what are some of the meetings, or is there any meetings in place, to actually talk about what the spectators raise, in terms of increasing, the number of people coming back to stadiums?
The coronavirus is being monitored and is being regulated by national. We always meet at those platforms that look at all possibilities. We are informed by our epidemiological reports. We are relying on science in whatever decision that we take on issues that relate to COVID-19. So as you have seen that we have been moving from alert level 5 down to alert level 1, simply because we have been monitoring that. As long as that situation permits, government is always prepared to review the decisions that are currently existing. So we're looking forward to that. We need to open the economy. We need tourists. We are those provinces that always enjoy tourism during festive season. We want our people to come back home safe, to stay here. You would understand we might be one of those provinces that look to be lesser in population. In December, all people come back home. Those who make Johannesburg to be Johannesburg, they come back home. Those who make Cape Town to be Cape Town, they come back home. So numbers tend to be bigger this side because all people are back home. So we want to address those kind of issues and make sure that by that time our people are ready. Wherever they are, they must vaccinate. So that when they come back home to their loved ones, they don't come and bring death, but they bring joy and happiness and festive season.
Not only that, Premier, tomorrow starts the initiation season. Many young boys from the province will be going to the initiation school. Is it safe to say that they can now go to the initiation school and also the stakeholders engagement with various departments in the province to ensure their safety, to come back from the initial school?
As you would understand that we have been relaxing this issue. We allowed them even in winter, more at a risk-adjusted approach. We continued to do so. I think even last year we allowed them towards the December for a certain period. So we continue to monitor that situation. We have almost about 70,000 young boys would want to go through this passage. We would want to go them safe and come back safe. Go there healthy and come back healthy. So that's what we are working for. We're putting every systems in place to ensure that we protect them, we look after them. We put reliance more on the families. It's families that must look after their kids. It's not government. Government can only support. So make sure that your child goes out there. I've got 4 boys that I'm taking through as well. I know wherever I am, it's my responsibility as a parent to look after those boys, to go home, make sure that I monitor that situation whilst they go through that process. So I can tell you it's something that is inevitable. We must go through it. But I believe that with the levels that we see with our numbers, we are actually holding our breath, patiently waiting. And I believe we also missed an opportunity during election campaigns when we had a lot of numbers coming around. If we would have done that together with the vaccination, we probably would have covered a lot of numbers on vaccination. But we are lucky now that we have said part of the preconditions, those boys must be vaccinated, not just be screened for health, they must be vaccinated so that as they go there and stick to the regulations that are in place, but we are also aware that they are also a bit safer from a vaccination point of view.
Yeah. Premier, lastly, before I let you go, we do understand that earlier this morning there was a briefing from the Department of Health. Gqeberha, the Minister of Health, also mentioned that in the fourth wave could hit our country mid-December, early January. And we understand that the Eastern Cape, a lot of people have been affected by the comeback wave. Is all hands on deck, and are we ready as a province, for that fourth wave?
We've been maturing with age, just like wine. When this hit us, it caught everyone by surprise, including the first world countries that have got the best healthcare systems in the world. They all collapsed. People died. So through first phase, second phase, we handled the situation with that maturity. Third phase. That's the reason that we have managed to contain the situation, particularly during third phase here in our province. We have tried to increase our capacity in our hospitals. Yes, we've got the challenge of the infrastructure. We have got a serious social infrastructure backlog in our province. That includes hospitals. I will never say that we're 100% ready. No one has ever been 100% ready. That's why people are dying even in UK, even in US. Because of COVID-19. No one has ever been ready, but we are doing our level best to make sure that we contain this and we really manage the spread of the virus. That's why we also put more reliance on our people to help work with us, take responsibility as they actually enjoy themselves. So we are nervous and concerned about fourth wave. We can't say fourth wave will be like third wave, and we know exactly that first wave was not like second wave, and we continue to experience this differently. But I can tell you we are better off. We have actually installed the oxygen in a number of our regional hospitals where it has never existed, the bulk oxygen. So you go around, you see those tanks, and that's why we were better in the third wave to contain, to manage the situation, but also to deal with those who would need oxygen in our hospitals. So yes, we know we will be having more numbers, and unfortunately the budget of those people who are in other provinces who have been actually counted there through census is with those provinces. When they come back, I know they expect better hospitals, and unfortunately our equitable share has been really negatively impacted upon by the outward migration. So that's a challenge that we have. So we can't have now all of a sudden a capacity of 10 to 12 million people because everyone is back home, which is the situation that is likely. So, but we have actually softened our boundaries. It doesn't necessarily mean that when you are sick here, you cannot go to the nearest province, etc. But as a province, we have tried our level best. So far, so good, and we will be able to handle that situation. When people need oxygen, they will be able to get it to the nearest hospital where they reside.
Premier, thank you very much for your time.
That was Premier of